Hi.
Hello, good afternoon.
Good afternoon. That's Dr. Jyoti Kapoor.
Yes,
Hi.
Jyoti.
Well, good. Now that you're here, we'll start. Well, first of all, a very warm welcome on behalf of Sambandh Health Foundation to all those who are joining us live on this chat with Dr. Jyoti Kapoor. Dr. Jyoti Kapoor, it's just giving a brief background on her. She's a senior consultant psychiatrist, currently working with Paras Hospital in Gurgaon. She has more than 15 years of experience of working with people experiencing mental health concerns. She uses a holistic biopsychosocial approach to explore psychological issues. She's involved with a number of NGOs, corporates, and other support groups, and is actively participating in counseling and awareness presentations with these. As a person, which is always a more interesting part to me, as a person, she's more of an explorer, a poet, and likes to challenge herself and to learn new things. And I'm sure, Dr. Kapoor, that the current pandemic has exposed you to learn a whole lot of new things, and we are hoping that you will be sharing all of that with us today. Before I turn to you, I wanted to just set the context for today's discussion, which is basically that I think we are all painfully aware of what the pandemic has done to all of us, what it has, and the aftermath that it has left all of us, and the focus that it has brought on physical health, as well as the infrastructure surrounding it. What it has also done is somewhere exposed the silent pandemic of mental health. I mean, those of us who are working in this space are already aware of it, we already knew of its existence. What the pandemic has done, it has somewhere not only exacerbated, but also visibilized the mental health pandemic and in a way opened up conversations around it. In the recent past, there have been a lot of discussions and dialogues on fear, on anxiety, on depression, on grief, on loss. And I'm sure you must have also participated in a lot of these discussions. But today, we are specifically focusing on people who were already vulnerable to mental health concerns, people who were already living with mental health issues like schizophrenia or bipolar, and how this pandemic has impacted them. So my first question to you to open this conversation is, in your clinical and professional experience, what have you noticed? How has this pandemic affected people who are already vulnerable to mental health? Has it affected? And if yes, how has it affected and impacted them?
Thanks, Vicky, and welcome to all. You have broached a very valid question, and the answer is yes, definitely. See, any kind of stress in our environment, it causes an exacerbation of problems or health issues, be it physical or be it psychiatric. And because this pandemic, and I have often said it, this pandemic is not only a physical health issue, it's become a social issue, it's become a psychological issue because of the chronicity and the kind of nuances it holds, being sudden, being unknown, causing uncertainty. So what it has done is that it has increased that stress level in everybody. And because people suffering from psychiatric issues are more vulnerable to these kind of stressors with or without treatment, these people have been affected far more, and the people who had been stabilized on medication, who had been many of my clients who were off medication, the anxiety patients who were off medication, they have developed symptoms again. The symptoms have reoccurred. Now, since the second wave, it has been huge. I mean, after the first wave, definitely it was there, but still muted. With the second wave, it's been huge. So I'm seeing more cases of depression, more cases of anxiety, people developing psychotic symptoms who were already stabilized, and the medicines had to be escalated. And one more important aspect is because of the confusion surrounding treatment, many people have not followed up adequately. We have been doing teleconsultation despite the fact that physical OPDs can be, risky. But still people have not been able to follow up. Family members who have caught COVID or patients who have caught COVID have unfortunately stopped their medication thinking that they should not be taking these medication. People have stopped medication with fear of interaction with vaccine, which has further escalated the problem. So all in all, there have been more cases, and people who were already vulnerable but not really taking clinical intervention have developed symptoms. So mental health has largely been adversely affected with the pandemic.
Mhm. So yes, I think in some ways when it comes to anxiety and depression, as you have talked about, and it has widely been both understood and talked about, and there in the various newspapers and various other forums. And you very specifically mentioned about psychotic and others. So today's discussion, I would specifically like to focus on people who are living with schizophrenia and bipolar and other serious mental illnesses. And I think you have rightly pointed out how various confusions regarding medication, regarding being able to access medical facilities, how that has. Could you give us some kind of an insight into what you have noticed in your clinical practice, where people who already have paranoia or schizophrenia symptoms or bipolar, what has happened to them? How have they become more vulnerable? And what are the various things that you're noticing in terms of which one could be watchful of going forward?
See, the thing is, one, that because lockdowns were placed last year also and this year also, the movement has been curtailed, because of which clients, especially from the rural area around our place, have not visited the hospital. And because everybody has been, the family has been busy, so many stable patients actually ended up stopping their medication. Ki medicine khatam ho gaya. Because of which there have been relapses. I have had patients who have been stable for years, and suddenly because of this. Now, unfortunately, even though this message was sent out that, doctor will be available at the hospital, if not, if you can't visit, they will be available through video consultation channels. But the rural population has been affected. Some of the clients have chosen to go to local doctors, which is a good thing, but some of them have chosen alternative treatments which haven't worked for them during this period. So there has been an increase in psychotic relapses, and bipolar disorder patients who generally have intermittent episodes of normalcy feel that they are fine and they are managing well, have not been able to, have had more relapses. Secondly, the financial strain the pandemic has put on families has also affected treatment, because now probably they can't afford doctors or they can't afford medication. Thirdly, there have been issues with getting medication, with the lockdowns and transports getting affected. Many a times the stocks have not been refilled by the chemists who were able to provide the medication earlier. So that has been an issue also. So the psychosis has increased. Then again, as I mentioned, the stress itself of the pandemic and the fear that they can catch an ugly illness, the paranoia associated with it has also made many a patients reluctant to get out of the house and seek treatment. They anyway didn't needed no reason to get out earlier because of the fear, and now it has been encouraged further because of the current scenario, and that has worsened the paranoia and the situations associated. So that's been a negative aspect, but one good aspect that I would say the pandemic has brought is more acceptability of video consultations. Now, this is something that I believe has been positive, because for years we did not have proper telemedicine guidelines in our country, and last year around April, we for the first time finally got from the Ministry of Health and Family Welfare proper telemedicine guidelines, and there have been a streamline of this process. And VIMHANS has taken the metal of trying to convey what is required, what is not, and we have been told what medicines can be prescribed, what can't, through the telemedicine guidelines. So, which is one good thing. So we are more accessible to patients through online methods, but unfortunately, people who are in the rural areas or far off areas and who didn't have an access have
Mm.
had a problem. But the good
Mm.
thing is those who have been able to come to us, now they know the method. It's far easier, we can connect through video consultation and we are able to do that. So it has had some, I think, good effect also from that perspective.
Yes, I think you're absolutely right about the accessibility factor being now more available to people, that you can be at home and yet be able to reach out to your doctor, and it doesn't
Mhm.
always be a physical visit. In your experience, have more people, including people from the rural area, since you brought out the rural-urban divide, have more people been able to, are they using this medium to reach out to you, both in terms of getting a consultation as well as getting an idea?
Yes, yes. Last year when we started this during the lockdown, the overall, it was almost half the OPD.
Mm.
So from
Mm.
the regular, we will see only 50%.
Mm.
Fortunately for me, I work with the team and we sent out broadcast messages to all my patients that I am available through this medium and through Facebook, and many were able to connect.
Mm.
This year, it's almost double the OPD.
Okay.
The online OPD is almost double as
Mm.
compared to how it was before. I
Mm.
guess because, yes, many of the people who used it last year were comfortable and could do it again. And
Mm.
then the message did go out farther and people were able to use it. So
Mm.
people are definitely benefiting.
Mm.
And even the rural population, because phones are available everywhere, thankfully.
Yes.
So everybody has phone, everybody has WhatsApp, and you can do a video call. And if bandwidth is a problem, you could use just a phone call. So
Mm.
it's from that perspective been good. The
Yes.
other thing is that many of our new patients with schizophrenia and bipolar patients are not
Mm.
willing to come to us, and so their family members had a problem getting them to the doctor to get treated. And for legal and ethical reasons, unless the patient was presented to us, we couldn't treat the patient. So good thing with online video calls has been that we have been able to talk to those patients also
Mm.
and examine them who were not willing to come to us. So these two things have worked out in our favor, and
Mm.
Sambandh has been quite helpful there as well, because they have been able to connect to the people and tell them कि video consult हो रहा है चलो कर
Mm.
लेते हैं. So that has been a very useful thing that you people also have been able to promote. So I think that one aspect has
Yes.
been positive because of the pandemic.
Thank you so much for saying that, because in some ways your validation means a lot, because what I'm, in a very morbid sort of a way, this is good news, because
Yeah.
like I said in my introduction, that there has been a silent pandemic which has perhaps always been there. But in some ways, the pandemic, COVID pandemic, has made it easier to seek consultation, to have an access to mental health professionals like you and others. So my question arises from here: have you noticed in some ways that has it led to also some amount of destigmatization of reaching out for help when it comes to mental health?
I would like to believe so, Vicky, and I would like to believe so also from the perspective that um, um, even the media has been able to focus on it. I mean, I have been on several platforms, and even media has been focusing on the mental impact, psychological impact of COVID, lockdown, and everything, which were not so much discussed earlier. Of course, we are still not discussing the more serious mental illnesses. But everybody is aware, especially when you are staying. See, the thing is, lockdown has put us all under one roof. Now, you
Yes.
could avoid a sick family member and just, okay, let them be on their own terms if they didn't want to seek treatment. Now, how do you do that? Because you're living under the same roof. So
Mhm.
I think that has, as you mentioned, in some morbid way, but yeah, but for me, it's important that a patient who could have been helped and could not be helped because it was largely ignored because of various excuses that the patient doesn't come out, that the patient doesn't want to visit the doctor or doesn't want to take the medication, is now being firmly approached to get
Mm.
treated because you have to live in the same house.
Mm. Mm-hmm.
They're unfortunate, but that doesn't mean that they didn't happen before. So we have seen suicides, we have seen the stress level getting to people to an extent that they can't handle it anymore and developing various problems. Domestic violence increase in the last year, news we heard. These all things are basically expressions of an underlying psychiatric issue that has gone unaddressed, even relationship issues for that matter. So from that perspective, I believe that yes, we are more open about it. Now we are talking more and we are willing to accept it more because there's no way we can ignore it. So once you start accepting, stigma goes down. Especially
Yes,
when the
yes.
treatments are effective, the stigma goes down that people were not earlier aware of.
Yes. So there is more opening up, more education, there's more discussion, there's more dialogue, and there is less ability to ignore and more accessibility.
Yes.
So on that, although in some ways you have already kind of highlighted a lot of things that I wanted to ask you, but I will still ask you in case something gets left out. Are there any potential risks of relapse or worsening of existing mental health concerns because of the pandemic, because of being, put into one place without any earlier available ways of being able to go out and, have some kind of off? If it does, then what are the ways to recognize the onset of these signs and address them in time?
See, like I already mentioned, that stress is a common factor, and when there is more stress, there is more illness, be it a blood pressure that escalates when you're more stressed or a psychiatric disorder. So, and it's been stressful. I mean, even if you are consciously trying to deal with it, saying that, okay, it'll be managed, but subconsciously, all the negative news and everything, the environment it creates in the household, the financial distress, it has created in many families, the lack of space because you don't have your own space, you are in the face of each other. That leads to frequent conflicts and altercations. आवाज कम कर दो, मैं पढ़ाई कर रहा हूँ, मैं जॉब पे हूँ, मेरा ऑफिस चल रहा है. All these things have caused a lot more strife and conflict, which has led to disturbance in psychological health of patients who were otherwise stable on medication and were managing. So, if we have to kind of focus on the warning signs, you will see the mood becoming more irritable, the person becoming more socially withdrawn or more aggressive, on either side, this or that, sleep becoming disturbed, frequent conflicts that were not otherwise happening, low stress tolerance. So all these things can show that, okay, things are not fine. We have to also be aware that many of our clients are unwilling to continue medication and if ignored because everybody is busy. Now, wife who used to take care of the things is busy because the maid is not there. So the kitchen she has to look after, children, their online classes, and here is the husband, and she says medicine ले लिया और ले लिया, and उसने medicine नहीं लिया. So, there is a very good risk of, the treatment getting ignored or not, people missing their dosages, which may lead to, which has, in fact, in some of the cases, led to escalation of problems. Some of the patients on depot treatments, injections, long lasting injections have missed their dosages because of inability to reach the doctor or get the medication on time. So, those are the things that need to be focused on. The what can be done about it is again, I think, a far more uh, uh, important discussion here. Once we know the risks, we have to take necessary action. So we have to accept that yes, in pandemic there will be certain things, so we have to make arrangements for already. One, doctor's consultations can become difficult, but online is available. So book pre, in hand. The rush is more, and we are not able to give immediate consultation. So book in advance. You don't have to wait till the last day and then say, कि अरे अब तो doctor available नहीं है या दवाई खत्म हो गई. So before your medication is over, get your prescription. Before the medication is over, talk to your chemist or pharmacist. Online delivery of medication is easy now, especially with the prescription of the doctor for most of the medication, even psychotropics, except benzodiazepine. So that is again something that can be pre-planned. So put it in a list of your monthly thing that these need to be done. Then space is important. It's important to find separate space. For caregivers, it is important for them to have time for themselves so they can relax and de-stress. And if they are not doing it, they are overstressing themselves. Ultimately, the whole balance breaks. So they need their time. So if the caregiving duties can be adjusted, given to other people, that a mother can look after for a while, the child can look after for a while, and the wife can look after for a while. So it is very important to give space to yourself and the patient. And finally, see, every new thing requires a adaptation.
Absolutely.
It's not just adjustment. Adjustment is something which is temporary.
Yes.
Now we are looking at a scenario which means that things are going to change. Lifestyles are going to be different. Working from home is going to be more common. Teleconsultations are going to be more common. So we have to adapt. We have to stop wanting to go back to past and start looking at creating processes which work for us in long term.
Yes.
So that is something which is important. So once we are able to do that, I'm sure we will be able to manage both the mental health aspects and overall lifestyle related aspects of the pandemic.
So what you're saying is adaptation is the name of the game. Adaptation is key, and it's a long-term adaptation. It's not in the short term. Well, pandemic we thought is going to be here for a month or two, and look where we are. And we absolutely have no idea how long it's going to continue. So good thing is that in talking to you today, one is also recognizing that there have been a lot of positive outcomes too. And you've also very nicely highlighted that how family members could share responsibilities, could plan how to approach and at the same time take care of themselves in a way that they also don't get burnt out. There is also a question which has come from one of our audience members. What about the people who live by themselves? Let's say they already live with a serious mental illness and they also happen to be on their own. Is there anything you would like to share? And they could be a part of our audience today. Is there anything you would like to
Exactly. In fact, had you not said it, I was going to talk about it, bringing forth the role of Sambandh. Almost 10 years back, when we were talking about Sambandh, many of my clients lived at far off places and were looking for some place like this where the patient could be sent. And they couldn't be because Sambandh was based in Gurgaon. How do they do it? And now we are online. We are online and we are talking, and your volunteers are doing great job connecting with people online. Webinars are being held, Zoom calls are being held online. So it is one of the greatest things that technology could bring to us. We have all the, I mean, we can say all the wrong things about technology, but there are some good things over here, and one of it is this. So people who are by themselves, bringing them into this social network is important. So one, obviously, if they have extended family that they could connect to, bringing them in the social network, and then connected with an institution like Sambandh is very important so that they are frequently connected. Their psychologists now, unfortunately, we don't have a very strong social networking or case manager set up from the government's side. So mostly it is privately based, and people have to find their own support groups. But I'm sure many are there and many more are coming up. So one thing is, and I think you can vouch for it, you can tell it to the people out there, that people who are by themselves should get into a support group or a social networking group and should be constantly in touch with their doctors, as well as their if they have a psychotherapist or a psychologist or a social worker who they are connecting with, so that they don't get isolated. they continue their treatment, and they have somebody to go to when they have a problem. So that I think we can manage.
So I hope all those people who are living by themselves and also dealing with mental health issues, I hope they're listening to you today and do find a way to reach out to some kind of support for themselves. This also brings me to a question of corona itself. You know, a person with mental illness could also become a patient of corona. Now, in the current state where a lot of the hospitals have turned their facilities to cater to COVID itself, first of all, if the mental health issues get amplified and exacerbated, are there any facilities that they can reach out to for that specific needs in case they need to actually go to a hospital and get hospitalized? Secondly, let's say if the mental health issues are under control, but they have become corona patients. Do you think, how is it for them to reach out to hospitals and get help for that?
See, in any case, when it comes to medical treatment, it is a triage thing. When we say a triage thing, the patient who needs medical help, whether he has a psychiatric illness or not. So if you developed an appendix problem, you would need to go to a surgeon and you would need to get operated. And I work in a private hospital over here. So I know that we get those patients admitted, whoever needs to treat them, and they need to get treated. So primarily for the COVID illness, and if the patient, be it a patient with schizophrenia or bipolar disorder, if their SpO2 is falling, if their fever is high, if they are having moderate to severe symptoms, they need to go to a doctor and they need to, take treatment like any other COVID patient. At the same time, continue psychiatric treatment. Now, that is very, very important because many people think that they can stop the treatment. You can't stop the treatment because it will worsen your psychiatric condition, which needs to be treated. So like you would continue your diabetes medicine, your hypertension medicine, similarly, you will need to continue your psychiatric medication and you will be treated like any other COVID patient. Now, second component is of patients who are who have psychiatric issues but are unstable and now develop COVID. So from that perspective, an unstable psychiatric patient needs to be admitted to a psychiatric facility, and there are few in Gurgaon who have this kind of an arrangement. So we work alongside the Tulasi Psychiatric Health Center in Gurgaon. They also have a facility in Delhi, and there are COVID isolation protocols also in the in-house facility. So if somebody has psychiatric illness primarily, but is COVID positive, but not having any major medical issues, can still be admitted. And similarly, Fortis has come up with Sukoon. So these are in private sector. And in government sector, almost all government medical hospitals have a psychiatry department. And if a patient needs admission, COVID or non-COVID would be admitted over there. So what I would suggest is, see, there have been lots of rumors and lots of fears, which have affected the patient in a manner, people in a manner that they haven't even gone and asked the right questions. They've just been worried and staying indoors. So many people call us and say, "Ki ye ho gaya, kya kare?" So then I tell them that nothing doing, ye ho gaya, so let's get you a physician's consult. Let's see your symptoms because your body has been infected. It needs to be treated, whether you have any other illness or not. So what I would tell people is that if you have any symptoms, go to your doctor. You will find a way. Don't go by news. Don't go by WhatsApp messages. Don't go by things that you will not be admitted. You will get oxygen. You will not get oxygen. Once you go to a hospital's emergency, the doctor will do something, will guide you properly. So that is the way to go, even if you have a psychiatric problem.
Yeah, but I think in some ways that exactly has been the issue because most of us have been hearing such horror news of people going to hospitals and not really being able to find the help that they need and being turned away, and then the shortage of all sorts of medicines. And this also brings me to what you had already mentioned, the financial health of families getting affected in this whole space. And the government and the civic hospitals essentially turning into COVID facilities, and hence not having the resources available to address the mental health needs of the community. Do you know, or can you suggest some of the places where, when there is a financial crunch and people are financially compromised, where people could still turn to in case the civil and government hospitals are not available, where their mental health needs could be addressed, whether it is in terms of hospitalization or medication?
Right. So, see, the government medical hospitals. So we have PJMS Rohtak, where we have the psychiatric facility running, where a patient with psychiatric problem can go to, and the treatment, admission, and all facilities are available. Similarly, in Delhi, we have VIMHANS and other places which are catering to. See, mental health indoor facilities are available, but people are wary of going to government setups in general. In private setup, we don't have many, but like I told you, these facilities are available. So if there is a financial issue, I would strongly recommend going to these government-run facilities, which are dedicated for mental health services. And in Delhi, we have VIMHANS, we have GTB, we have RML Hospital. All these are dedicated mental health services, and there are doctors working over there. So definitely those things are being catered to. The OPDs are running over there. Hospitals have not been closed. If somebody requires financial help, then frankly speaking, we at Manasthali understood that there was a need for psychological counseling of people who were being affected by the COVID stress. So we started a helpline. So we have also associated with the volunteers who are willing to financially support people who can't take help. So if somebody comes up and says that they want financial help, then we are in touch with a few people who would be willing to support them as well. So one thing the pandemic has brought up, and I am instinctively a positive person. I believe that's what we need to do. Yes, there have been a lot of negative going on. So we hear stuff about, people selling medicines and oxygen cylinders at horrendous prices. But we have seen so many good people come up to help.
Yes.
And they are there. We need to focus on them also. They are the one probably who are carrying the word around even today. And I have come across in this venture, I have met people, I have talked to them because I was wondering how to, because a single person cannot do it. It's always, a pooled effort. And we have been able to find people who've said that, I'll come forward, I'll help. I have volunteers, psychology graduates who are saying, we'll take free sessions, don't worry. I have medical coordinator, volunteer. She says that I will help out, try to, find video consultations, book physician appointments for COVID patients. So tell me that part, which is non-psychiatric, I'll manage that. So people are there. So you can reach out to these government setups. I will also, through you, give the helplines number. We can be reached out to, although primarily we are dealing with the mental and emotional support. But if there is anything else we can do, we'll try to do that as well.
Thank you so much for that. And I think what I'm most thankful in this conversation with you, and I'm sure all those who are listening to you, will be that while we've been witness to a lot of trauma and a lot of grief, and perhaps also some bit of exploitation in that process, but at the same time, I think what you have drawn my attention to is the positivity of it all. There have been a lot of positive outcomes, and we must factor in those and acknowledge those, whether it is reducing the stigma around mental health, whether it is making mental health professionals more accessible to people around us, whether it is a civil society, the government hospitals, your organization, volunteers who are in some ways coming together and reaching out and providing support to people as a community, whether it is at the physical illness level or whether it is with people who are living with mental health issues and mental illnesses. So all in all, Thank you so much for this uplifting conversation in these times. I think it is much needed. I think people will be much helped by all the information that you have shared. And yes, we would like to get the contacts of all the details that you have mentioned and put it along with this video today so that people will have that information available to them. And when they need to, they reach out to all these resources. And at the end of the day, I think the only message that we need to take forward from you and us together, that we are all in it together. And adaptation is the name of the game, and it's a long-term adaptation. And in some ways, as a society, as a community, we will find answers, provided we continue to hold each other's hand and provided we continue to help and support each other in these difficult times. On that note, Jyoti Kapoor, thank you so much for taking this time out and sharing a valuable experience with us. Thank you very much.